Good morning. So nice to have you join us today. I know it's been a very busy, hectic, worrisome day for so many of us here in the Tennessee Valley, but we're going to look ahead to the sunshine that's coming our way as the day goes along. And in the summer weeks that are just around the corner, our first guest, Dr. Hunter Garrett, is here. And for all of you sports moms and dads, he has a message for you because he's with Erlanger Orthopedics, and this Saturday, y'all are doing free sports physicals, right?
Right. So with high school and middle school athletes, everybody is required to have a sports physical for that year, and it's good for 1 year. So we're doing sports physicals at Erlanger South this year, and that's a great way for athletes to get screened for overall health-related issues, as well as to talk and get familiar with physicians in the community.
You were a baseball player
Yes.
in college, so you know about this quite well and the importance of it. It's not really just to get the clearance for your sport. In the sports physical, you're looking at some very specific things, right, to then help keep the athlete safe.
Right. We do a mental screen as well as a physical screen, but also a history screen, and that's where we're going to pick up on a lot of our issues as far as our athletes are concerned. So you have these sudden sports injuries that occur on the field that we can hopefully prevent in the future.
What do you mean a mental look as well?
So we do psychiatric screens, so we determine if there's any depression or anxiety associated with sports, but also just in general life. And we can make those recommendations to see your primary care doctor or have a follow-up with one of us.
Well, I bet that's becoming an increasing aspect of what you are even seeing among these students, boys and girls. There's high pressure in being a kid these days.
Absolutely. There's so much pressure as far as to perform at a high level, but also to go into the classroom and perform at a high level as well, because the student athletes are looked at favorably upon their peers as well as the community.
Right. And for so many of them, especially in those high school years, as I mentioned, he played baseball in college, but they're looking at scholarship money that's on the line, and there's a real fear of disappointing not only themselves but those who are cheering them on.
Absolutely. Parents have put so much time and effort into it, so this is a great time to get from a physical standpoint to make sure there's nothing else going on, but really focus on the physical and the mental aspect of sports physicals.
If you are a multi-sport athlete, does the one sports physical cover all of it?
It does. So it covers you fully for the year, no matter what the sport is, whether it's cheer, band, football, it doesn't matter.
Okay. You're doing this basically in Ringgold at Erlanger South. You're a non-surgical orthopedist,
Right.
correct?
Yeah. So if at all possible, I try to keep people away from surgery if that's in the best interest of the patient as well as going forward. So that's what my main role is. But also we look at it from a sports and orthopedic standpoint as there are mental aspects to injuries and whatnot, but also the physical of how we can get them back. We utilize our team, physical therapists, surgeons, and everything else in our community.
A lot of schools for a sports physical, I think this is accurate anyway, have a form to fill out. Do parents need to bring that to you?
So it'd be great if you were able to go to your local governing body, whether it's TSSAA or the Georgia form. They can print that off and bring it to have it pre-filled out. It'll speed up the process a little bit, but we'll have forms there as well.
Okay, so because I was going to ask you, is it a pretty quick, almost assembly line type of a day, or if there has been an injury of some sort, is it helpful to have that conversation while they're meeting with you?
So if they've had an injury, we usually want them to see it in an appointment so we can do a further, more in-depth workup. So this is more of a screening process, so it's very assembly line. We use our athletic trainers as well as our service representatives as well to try to speed the process up so everybody is efficient as far as getting in and out, and we have an idea of what to do next.
So it's 8 to 11 on Saturday.
Correct.
All parents have to do is be mean enough to wake their kids up
That's
early
right.
on a Saturday
That's right.
morning to come to you, right?
Absolutely. So we look forward to seeing everybody at 8 a.m. on Saturday.
How many of you will there be?
There will be quite a bit of us, numerous athletic trainers, and then multiple providers getting ready to do all the physicals.
Is it important, do you think, for athletes these days to have a trainer as part of their team to make sure that they're staying safe? Because muscle injury is very different from a broken bone.
Right, so that's a great question. At Erlanger, we value these athletes in a way that every high school in the Chattanooga community is actually sponsored from Erlanger standpoint to get that athletic trainer. So that way we can not only follow the mental and physical aspects, but also this day-to-day sport-related injuries.
Okay, well, bribe them with a donut and a cup of their favorite drink in the car, and here's where you're going to want to go. It's Erlanger South in Ringgold, right there, and it's Erlanger Primary Care, is that right?
That's right, that's the location.
8 to 11. This Saturday morning. You can always learn more at erlanger.org, and thank you so much.
Absolutely, thank you.
A simple step can lead to unexpected consequences.